Welcome back. The doctor is in and we're talking kids with Lexington pediatrician Dr. Caitlynn. And today's topic, fifth disease. We were just talking about it and you've seen an increase in it as well. So for our viewers, kind of what is this? What are the symptoms that go along with it?
Yeah, so fifth disease, it's a common childhood virus. It's actually a parvovirus, not the kind that dogs get. You can't pass it to your dog or get it from your dog. Okay. But we do tend to see it kind of in that 5 to 9-year-old age range, which is school age, right? And it tends to present more with a sort of fever, tummy symptoms, just feeling really tired, and usually that happens about 5 to 7 days before they'll get this very textbook rash that develops. So it used to be called this slap cheek appearance. So these kids have these bright, almost sunburned looking cheeks, and then over the course of a couple days, this rash sort of spreads down onto the torso, all the way down to the legs, and the rash on the body is more of what we call a lacy reticular rash. So it kind of has it looks like, you know, red lace just kind of all over the body. Usually once you see the rash, you're kind of like, oh, that's what's been going on for the past week, because, you know, a lot of these kids come in, they get COVID, flu, strep tested, and you're like, everything's negative, it's probably some other virus. So usually when we see the rash, we're kind of reassured, we're like, oh, okay, that's what it was, right? And so for most kids, and by the time most adults are 40, they will have had this virus, but for most kids, it's usually pretty benign. The rash can hang around for another week to 3 weeks. It sometimes can be itchy, but most of the time they aren't very bothered by it. But the thing that we do worry about is like pregnant women, if they were to contract this from their kid, it can be very dangerous for fetuses. So it can be passed to the fetus, which can cause fetal anemia, miscarriages, other issues. And then anyone who has a compromised immune system, it can cause a pretty significant anemia. So anyone who has like those hereditary anemia syndromes, we always just kind of keep a closer eye on them.
Okay, good to know. And what you just said, it's just about keeping them comfortable. There really is no medication.
Yeah, and like I said, once they have the rash, it looks awful, but they're no longer contagious. It's kind of like that post-viral rash syndrome. So
good to know. Well, Dr. Caitlynn, thank you for coming in this morning, and make sure y'all stay with us. We're going to have more Good Morning Kentucky after the break.